Normal values for echocardiographic measurements will vary with age, body surface area, and the population being evaluated. It is almost impossible to memorize the normal values for the numerous echocardiographic measurements in use. Various national guidelines have provided posters and pocket guides for use whenever needed. EchoCalc is a mobile application from the British Society of Echocardiography, which is available for download from the Apple App Store and Google Play. There are a few useful tips for visual assessment during routine echocardiography. Most of the chamber sizes are checked in diastole except the left atrial diameter, which is measured in systole. Of course, left ventricular dimensions are measured in both diastole and systole. In general, left atrial and aortic diameters are roughly equal when seen from the parasternal long axis view. So it is easy to make out enlargements, though this does not apply when both are dilated. The size of a ventricular septal defect, VSD, is compared to the diameter of the aortic annulus. If it is more than half of the aortic annulus, it is considered as a large VSD. There is another classification into small, medium and large depending on VSD size being less than 1/3, 1/3 to 2/3 and more than 2/3 of aortic size. The normal reference ranges for echocardiography NORAE study enrolled 734 healthy volunteers from 22 institutions across Europe, USA, UAE and Japan. Free full text is available online from the European Heart Journal Cardiovascular Imaging website. Normal reference values from the British Society of Echocardiographic guidelines is also available online with free full text access from PubMed Central. EchoNormal study was another project which used data from 22,404 adults. They have given normal ranges for different regions like European, East Asian and South Asian. Full text of that article is also open access. While assessing right-sided chambers, the effect of respiration and hydration status should be noted. Sizes of right-sided chambers and Doppler velocities will be lower in a hypovolemic state. Normal inferior vena cava collapses in inspiration, while absence of inspiratory collapse is a feature of right heart congestion. The significant level of gradient across the tricuspid wall will be just 2 mm of mercury for tricuspid stenosis, while it is 5 mm of mercury for mitral stenosis. This is because tricuspid valve has a large area and is in the low pressure pulmonary circulation. Gradients will be higher across normal valves in the presence of an abnormally increased flow like left to right shunts and hyperdynamic circulatory states. This is applicable to diagnosis of associated pulmonary stenosis in atrial septal defect and aortic stenosis in aortic regurgitation. Flow rate is also important while assessing severity of stenosis. In a low flow state, even severe stenosis can have low gradient. The classical example is a low flow, low gradient severe aortic stenosis. In pediatric age group, measurements should always be compared with a nomogram. For example, coronary diameters in a suspected case of Kawasaki disease is very important in diagnosis and treatment. Another measurement is pulmonary artery size in cyanotic congenital heart disease with low pulmonary blood flow. In all these situations, SED score is important. SED score is measured in terms of standard deviations from the mean. Simply put, it is the number of standard deviations by which the observed value differs from the population mean. First set of journal references. Second set of journal references.